Warning: 17 danger signs of kidney disease you can see on your body. You might think you're fine. You feel okay, maybe a little tired, but nothing serious. But what if I told you your skin, your nails, even your breath could be quietly warning you that your kidneys are in danger? Don't miss this, because knowing these 17 early signs could literally protect your life. Here's the scary truth. Kidney disease is often silent until it's too late. In fact, 9 out of 10 people with kidney problems have no idea anything's wrong. No pain, no clear warning, but damage is happening deep inside, every single day. But here's the good news. Your body does send signals, and if you know what to look for, you can catch kidney disease early, sometimes years before it becomes serious. So in this video, I'll walk you through 17 visible signs of kidney trouble, simple things you can spot with your own eyes right now. No blood test, no hospital, just awareness. If helping your health matters to you, go ahead and hit subscribe so you never miss these life-saving tips. Now, let's get into it. 1. Foamy urine. Have you ever looked down and noticed your pee looks weird? Like beer foam that won't go away even after flushing? A little foam here and there? That's normal, especially if you're dehydrated or peeing fast. But if it keeps showing up and the bubbles stick around like they've got something to say, they probably do. See, healthy kidneys act like tight coffee filters. They keep the good stuff, like protein, inside your bloodstream. But when those filters start to break down, protein leaks out. It ends up in your urine, and that's what causes that persistent foam. It's called proteinuria, and it's often one of the first warning signs of kidney trouble. The scary part? Most people ignore it. They think it's nothing until it becomes something big. So here's the truth. If you're seeing foamy urine regularly, don't guess. Don't wait. Talk to your doctor. Catching kidney damage early can make all the difference. It could save your kidneys. It might even save your life. 2. Pitting edema. Swelling in legs or eyes. Your socks leave deep marks on your legs. You wake up with puffy eyes. You press the skin and it dents like memory foam, taking forever to bounce back. That's not just water weight. It's called pitting edema, and it's your body holding on to fluid. One of the biggest reasons? Low levels of albumin, a key protein that helps keep fluid where it belongs, in your blood vessels. Your liver makes albumin, but your kidneys control it. When your kidneys get damaged, they start leaking this protein into your urine instead of keeping it in your bloodstream. And when albumin drops, fluid seeps into your tissues. That's when the swelling begins. And it doesn't stop there. More swelling means more pressure, and that vicious cycle can silently get worse. Most people blame age, salt, or stress. But sometimes the swelling is your kidneys crying out for help. Listen to your body. Don't wait for things to get worse. If the swelling doesn't go away, get checked. It's not just about your legs. It's about your life. 3. Frequent nighttime urination, nocturia. Losing sleep every night just to pee? You fall asleep and boom, 2 a.m., 3 a.m., 4 a.m. You're waking up again and again, heading to the bathroom. It's not just annoying. It could be your kidneys quietly telling you something's wrong. When your kidneys are healthy, they concentrate urine at night so you can sleep through till morning. But when they start to struggle, they lose that function. Your bladder fills up faster even while you rest. Sure, you might think it's just age, or I drank too much water. But if it's happening night after night, there's more to the story. This constant sleep disruption is more than fatigue. It's a red flag. Your kidneys may not be filtering waste like they should, and when waste builds up in your blood, it doesn't just affect your bladder. It affects your whole body. The scary part? For many, this is the first and only symptom they get before serious kidney damage kicks in. So don't ignore it. Don't blame it on age. Your body is whispering, listen now, so you don't have to scream later. 4. Half and half nails. What if your fingernails were quietly warning you that your kidneys are in trouble and you never noticed? Take a closer look. Are the bottoms of your nails pale or white, while the top halves look darker, almost reddish or brownish? That's not just a weird nail pattern, it could be a sign of chronic kidney disease. Doctors call them half and half nails, and they're more than a cosmetic issue. When your kidneys begin to fail, waste builds up in your blood. That imbalance affects everything: your blood flow, your protein levels, your mineral balance, and yes, even your nails. Around 20 to 40% of people with kidney problems develop this symptom. No polish, no injury, no trauma, just your body waving a red flag right at your fingertips. And the scariest part? It's easy to miss. You think it's nothing. You ignore it. But these small clues might be the only early warning signs before things get worse. So next time you're clipping your nails, don't just clean them, inspect them. Because sometimes your body whispers before it screams. And if you listen early enough, you just might save your kidneys and your life. 5. High phosphate, skin and blood vessel damage. You notice a strange bump under your skin. It's small, hard, and painful. At first, you think it's just a pimple, but what if it's something far more serious? When your kidneys aren't working well, phosphate starts building up in your blood. Normally, your body gets rid of phosphate through urine, but weak kidneys can't filter it out. And when phosphate builds up, it binds with calcium and forms tiny crystals. These crystals can settle under your skin, causing lumps that itch, hurt, and won't go away. In some cases, they can even break through the skin or cause wounds that don't heal. This is called calcinosis cutis. But there's a more dangerous version, calciflax, when these crystals block blood vessels. It can lead to ulcers, tissue death, and even organ failure. That's why phosphate control is so important for people with kidney problems. If you see unusual bumps or wounds, don't ignore them. Your body might be warning you before it's too late. 6. Hard arteries. Vascular calcification. Your blood vessels are supposed to be soft and flexible, but what if they slowly started turning into bone? It sounds strange, but for people with kidney problems, it's a silent threat called vascular calcification. Here's how it works. When your kidneys are damaged, they stop clearing out extra phosphate. That phosphate builds up in your blood, and over time, it starts sticking to the walls of your arteries. Little by little, your blood vessels stiffen. They lose their stretch. Your heart has to work harder just to pump blood through them. In some cases, this hardening shows up on X-rays, like cement setting inside your body. And the scariest part? You won't feel a thing until real damage is already done. This is why catching kidney problems early matters so much, because when your kidneys fail, your arteries follow. Don't ignore the warning signs. Protect your kidneys. Protect your heart. Protect your life. 7. Muscle cramps. It starts with a cramp in your leg at 2 a.m. You stretch it out, roll over, and try to forget. But your kidneys don't forget. Muscle cramps, especially the kind that strike at night, can be more than just dehydration or a weird sleeping position. When your kidneys begin to fail, they can no longer balance key minerals like calcium, magnesium, and potassium. Even your blood's acid levels start to shift. The result? Your muscles react. They tighten. They spasm. These cramps can feel sharp, sudden, and far more intense than usual, and they don't always fade fast. Many people shrug them off, but when they keep coming back, night after night, it's time to ask, why? Because this might not be a leg problem, it might be a kidney problem. And the sooner you catch it, the better your chances of slowing down kidney damage before it goes too far. So if you're waking up with muscle cramps more often than before, don't just stretch it out. Look deeper. Your kidneys could be asking for help. 8. Weak bones/loss of height. 3 bones/loss of height. You look in the mirror and something feels off. You're standing tall, but somehow you seem shorter than before. It's not just posture. It might be real height loss. And this could be more than aging. It could be your kidneys quietly signaling trouble. Healthy kidneys help balance minerals like calcium and phosphorus, but when they're damaged, your body produces more parathyroid hormone, or PTH. That hormone pulls calcium from your bones to keep your blood levels stable. Over time, your bones become weaker and thinner, a condition called renal osteodystrophy. One early warning sign? Gradual loss of height, maybe half an inch, maybe more. You might also feel bone pain or experience fractures from minor falls. But often the change in height shows up first. If you've noticed your clothes fitting differently or feel like your spine is curving, don't ignore it. This isn't just about getting older. It's about your kidneys and bones working behind the scenes, and both need your attention before it's too late. 9. Itchy skin, uremic pruritus. You scratch and scratch, but it's still there. A deep, burning itch that won't go away. No rash, no bumps, just that constant urge that keeps you up at night. This isn't dry skin, it's something deeper. It's called uremic pruritus, and it could be a warning sign that your kidneys are failing. When your kidneys stop filtering waste properly, toxins build up in your blood. Those toxins irritate your skin from the inside out, causing an itch that feels impossible to soothe. For some people, it starts on the back. For others, it's the arms or legs. But no matter where it hits, it doesn't stop. It drains your energy. It ruins your sleep. And because there's no visible rash, most people ignore it or treat it like a skin issue. But this kind of itch isn't on the surface. It's a message from inside. So if you've been struggling with deep, unexplained itching for weeks, don't just reach for lotion. Get your kidneys checked. Because this might not be a skin problem, it might be a kidney problem. If this is helping you learn something new, or maybe making you think twice about your own health, go ahead and hit that subscribe button. There's a lot more coming that could really make a difference for you or someone you care about. 10. Restless leg syndrome. You're exhausted, but your legs won't let you sleep. They tingle, twitch, crawl, and the more you try to rest, the worse it gets. That's restless leg syndrome, a condition that feels minor but could point to something major, kidney trouble. When your kidneys stop working properly, toxins build up in your body. Those toxins trigger inflammation, which increases a protein called hepcidin. Hepcidin blocks your body from using iron, and without enough iron, your brain can't produce enough dopamine, a chemical that helps control movement. When dopamine drops, your legs act out. They jerk, they twitch, they won't let you rest. It's more than just an annoying bedtime issue. Night after night, it steals your rest, drains your energy, and wears you down. So if you're struggling with restless legs and nothing seems to help, don't just blame it on stress or aging. It might be your kidneys asking for help. Get checked, because sometimes the thing keeping you awake at night is trying to save your life. 11. Metallic taste in mouth/bad breath, uremic fever. Your favorite food suddenly tastes off. There's a bitter, metallic edge you can't ignore. You brush your teeth, chew gum, rinse your mouth, but nothing helps. And then someone close to you says, "Hey, your breath smells a little strange lately." That moment feels small, maybe even embarrassing, but it's actually your body waving a red flag. When your kidneys stop filtering waste properly, one of the first things that builds up is urea. That urea ends up in your saliva and breaks down into ammonia. The result? A metallic taste, a urine-like breath odor. Doctors call it uremic fever. It doesn't hurt, it doesn't look scary, but it means toxins are building up inside you. And if you ignore it, the next signs may be harder to reverse. So if you've noticed food tasting strange or your breath changing, and you can't explain why, get your kidneys checked. This isn't about breath mints. It's about catching kidney disease before it's too late. 12. Nausea, vomiting, loss of appetite. Lately, even the smell of food turns you off. The meals you used to crave now make your stomach churn. You haven't changed your routine, but something feels off. This kind of sudden nausea or loss of appetite could be more than stress or a bad day. It could be your kidneys waving a red flag. When they stop working properly, toxins called uremic waste build up in your blood. These toxins can reach your brain, especially the part that controls appetite and nausea. That's why many people with kidney issues feel sick in the mornings, sometimes even vomiting before eating. Over time, this leads to unplanned weight loss, weakness, and fatigue. The danger? Most people ignore it, thinking it'll pass. But if this keeps happening for days, and you can't explain why, don't brush it off. Your body is speaking. And your kidneys might be the ones crying for help. 13. Easy bruising/bleeding. You wake up with a bruise you can't explain. No bump, no injury, just a dark mark that appeared overnight. Or maybe your gums bleed every time you brush, or you get random nosebleeds without warning. These small signs might seem unrelated, but they could point straight to your kidneys. When kidney function starts to decline, it affects more than just your urine. It can change the way your blood clots. Your platelets, the cells that stop bleeding, become less sticky. That means you bruise easier and bleed longer, even from minor cuts. And what looks like a simple bruise might actually be your body's way of whispering something's wrong. Don't wait for the whisper to become a scream. If you're noticing unusual bruises, bleeding gums, or nosebleeds more often than before, get your kidneys checked. Because your blood is telling a story, and your kidneys are at the heart of it. 14. Uremic frost, white powder on skin. A thin layer of white dust on the skin might seem harmless, but in people with late-stage kidney failure, it could be something much more serious: uremic frost. This rare condition happens when the kidneys can no longer remove urea from the blood. As urea builds up, the body tries to push it out through sweat. When the sweat dries, it leaves behind a chalky, powder-like coating made of urea crystals. It often shows up on the face, neck, or arms. While it might look like baby powder or dry skin, it's actually a sign that toxins are flooding the body. Many people with uremic frost also feel extremely tired, confused, or itchy. This isn't just a skin issue, it's the body's way of saying, "I'm overwhelmed." If this symptom appears, especially along with others, it's time for you to seek emergency care, because when toxins reach the skin, it means the kidneys are no longer able to keep up. 15. Uremic pericarditis, inflamed heart lining. If your chest is feeling pain, and your first thought is something wrong with my heart? But what if it's your kidneys? When your kidneys stop filtering waste, toxins build up in your blood. One of the rare but dangerous effects is called uremic pericarditis, inflammation of the outer lining of your heart. It feels like sharp chest pain. It gets worse when you take a deep breath or lie flat. This isn't heartburn, it's not a pulled muscle. Your heart's still beating, but the irritated lining makes every movement painful. Doctors may hear a scratchy sound through a stethoscope. You might feel pressure, discomfort, or fear you can't explain. This is your body's alarm system, and the connection between kidney failure and heart pain is very real. If you or someone you love has kidney issues and starts feeling chest discomfort, even mild, don't wait. Get it checked. Uremic pericarditis can be reversed if caught early, but ignored, it can lead to serious complications. Your kidneys and heart are talking, it's time to listen. 16. Fatigue and anemia. No matter how much you rest, your body still feels heavy, like it's carrying something it can't shake off. Climbing stairs leaves you breathless. Just getting through the day feels like a marathon. That deep, unshakable fatigue might not be stress or age. It could be your kidneys trying to tell you something. When kidneys begin to fail, they produce less of a hormone called erythropoietin, or EPO. EPO tells your body to make red blood cells. Without enough red blood cells, your body can't carry enough oxygen. The result? You feel weak, foggy, drained. Not just in your body, but in your mind. This is anemia, and it's incredibly common in people with kidney problems. It steals your energy, your focus, and your joy. If you've been feeling tired all the time, more than usual, don't ignore it. Get your kidneys checked, because the sooner you act, the more life you can get back. 17. No symptoms at all until stage 3 or later. No pain, no symptoms, no warning. That's how kidney disease often begins. You feel fine, you go to work, you exercise, you live your life. But deep inside, your kidneys are struggling, and you don't even know it. That's why chronic kidney disease is known. Most people don't find out until stage 3 or later, when nearly half of their kidney function is already gone. And once that damage is done, you can't get it back. Many cases are discovered by accident, routine checkups, blood work, or a urine test for something unrelated. The doctor sees high creatinine or protein in your urine. That's the moment most people first hear the words, "You may have kidney disease." It's scary, but it doesn't have to be too late. So if you haven't been tested, or you're dealing with any small signs from this list, ask for a checkup. A simple blood test, a quick urine sample. It's easy, and it might just save your life. I hope this video gave you a clearer picture of how your body can quietly ask for help, especially through your kidneys. These small organs do so much, and they often don't get the attention they deserve until something goes wrong. But now you know what signs to watch for, and if you noticed any of them, don't ignore them. Take it as a gentle nudge from your body to check in, not something to panic about, but something to take seriously. If you found this helpful and want more support on your health journey, hit subscribe so you don't miss what's coming next.